Welcome everyone. Thank you for joining us for the first APA webinar in our autumn-winter series of webinars. And do keep an eye out. Carolina will put in a text box the link to some upcoming webinars during the talk tonight as well. So the wonderful Dr. Marda tonight. Some of you might know him well, and he's going to talk to us about long COVID and Ayurveda. Before we start, we've got a little bit of housekeeping. If we can ask everyone to please keep their computers on mute, so please keep it silent on mute, and we will keep checking as well that everyone is muted. Any questions that you have, please put this in the text box and we will read the questions out to Dr. Marda at the end of the webinar because he's got quite a lot of amazing information and practical info to go through. And yeah, I think I'll give it over to Carolina.
So we are so pleased Dr. Marda accepted our invitation to talk tonight. Thank you so much. He's a very busy man and a practitioner in Pune. He runs extremely busy clinic and devotes his lives to so many patients day and night and sometimes middle of the night. So we are very lucky to have a little bit of his time. He's also doing a lot of research and he's traveling worldwide all the time. He's able to be in multiple countries at very short periods of times and teach to large groups of students worldwide. So he's a very well-known practitioner, researcher, and Panchakarma expert as well. So he's been very busy in the last couple of years working with COVID patients and sorting out complications of that condition, and he will share a lot of practical information. Dr. Marda is always very good with making the knowledge very accessible and practical, and a lot of you have been to his lectures before at Middlesex or at a College of Ayurveda or in other countries, so you know how practical his approach is. So I'm really looking forward to learning some recipes and some protocols, so I hope you get a lot out of it. This recording will be available in case you can't catch all the recipes and notes, so please don't worry. And over to you, Dr. Marda. Thank you again for your time and expertise in advance.
Good evening, everybody. Thank you, APA, Carolina, colleagues, Sue and Andrew, because giving me this opportunity to be again in front of APA. Today's subject is interesting and bothering subject all over the world, including few of us, because we have also exposed to COVID and we also had some of the impact. So my today's lesson will be just, we will go through what is long COVID, a quick review in a way. So we will get an idea that how broad it is until now. Probably it will be more broad when a few years more it will go. So long COVID is something which is a very big thing in the world, not just in UK or India. And then we'll see why it happened, the propositions different scientists or different researchers put forward. So I have compiled that. Then we will come back to Ayurveda and we'll see how Ayurveda look at that. And we'll try to see some of the recipes and some of the classical advices, how to recover from this long COVID scenario. I know that when you will see the long COVID, you will realize that it's a really big subject. So I've chosen few. I cannot finish everything in 1 hour, but I will try to give you maximum. Then if you have some specific question, you can ask me at the end. So let's begin. What is long COVID? So as we know, the people who got infected with this new coronavirus, they experience some long-term effects after their initial period is over, and that is called as a post-COVID condition or long It is termed with different names like long haul COVID, post-acute COVID-19, or post-acute sequel of SARS-CoV-2, which is more like NIH USA definition, or long-term COVID effect or chronic COVID. The World Health Organization define it in a particular time frame. Means if you have had the coronavirus symptoms because of the infection, and if they persist or return back, so it's not just persistence, also return back more than 3 months. So you got a corona infection, probably you have received some isolation treatment, whatever. You got out of that, and either you continue the symptom for more than 3 months, or you thought you are all right, but 3 months after, again, some of the symptoms start to appear. That is considered as a long COVID or post-COVID condition. And that moment, World Health Organization was considering 3 important symptoms. If they, one of that or 2 of that or 3 of that, if you see, definitely it's going to be long COVID. One was fatigue, second was shortness of breath, and third was cognitive problems in thinking and memory. What it means? It means that the work you used to do before, if you feel worse after doing 25% of that work, that is coming under fatigue. And if you are not able to do the thinking and memory process which you were used to do, or you feel like disconnected, or if you feel like exhausted, then it's a cognitive problem. So, and some respiration. So these are the symptoms they considered initially as a marker for long COVID. Now, this was in 2021. The next review, 2022 review, will be soon published, and probably you'll see a big list of other symptoms as well. These symptoms can come and go, but they will have an impact on your day-to-day life, and they cannot be explained by any other health problem. That is the precondition described by WHO. Now, if we go to UK, for example, the NICE, National Institute of Healthcare Excellence in UK, that divides post-COVID or COVID in 3 clinical cases. One was active COVID. So you got COVID, you have the signs and symptoms up to first 4 weeks. Second will be long COVID, which, and that is interesting because it's not just the symptoms persistent of COVID, but you may have new symptoms, 4 weeks or more than that. And then they did a third thing, because this is what NICE added, that in addition to clinical case definition. So you have particular like fatigue, etc., but you may have new symptoms. And this is more and more rising now. There are many patients coming to me, they never had something before. For example, I give you a very interesting example. I have families, last 33 years, they are coming to me since the day 1 of practice for cough, cold, in flu, season change, etc. They used to take similar kind of medicines, which has some black pepper in it. For example, Andrew know that better. And the grandfather was taking that, the father was taking that, the grandson or granddaughter was taking that. And now, after COVID, I gave the same medicine for the same complaint, and they have mouth ulcers, and they have some redness here, and they could not swallow. And I got shock of my life. And then I identify these people are reacting to black pepper, or these people are reacting to green chili, which they never used to. So this is something new. The same medicine they were taking in a family tree for 33 years, and now they are reacting. And it's not that the grandson is reacting, it's the father also reacting, the grandfather is also reacting. So something is changing, and that's why the NICE definition is really appealing, that something new is coming up. Okay, so additional effect. So you will have both ongoing thing, and you may have additional. Now, if it crosses to 12 weeks, then it's going to, according to NICE, it's a post-COVID syndrome in a way. So this again, after 12 weeks, and not explained by any alternative diagnosis. And second thing, they present as a cluster of symptoms. So it's not one symptom. It's overlapping each other, few symptoms, or even multiple symptoms. So this is post-COVID syndrome. So you may have fatigue, you may have memory or cognitive dysfunction, and you may have heart palpitation, you may have shortness of breath, you may have few things together. But as they are of different system, you're not linking in them, and you try to identify and you don't find any reason. For example, today only I had a patient, a young chap, whose pancreatic function, like serum amylase and lipase, is super high, but all his scan, all his blood analysis, and everything is normal. Pancreatic structure is normal, liver structure is normal, gallbladder is normal, everything is normal. And now what he is having is some colonic inflammatory condition. So which is not really directly linked with pancreas. And then he have also some cognitive. So 3 different scenarios. He come up to me and he was absolutely normal until almost end of 2020. And sudden outburst. And they tried all probable medication, but the lipase and amylase is not coming down. He looks normal, he live normal, but this is here. So something which is bothering him for about a year, 1 year. So this you have to understand. So it's a multiple things, multi-system, and multi symptoms, maybe more than 1 or 2. So cluster of symptoms. Now NIH also defined the same thing, who don't recover over a period of few weeks, they say, and that is what they call PASC, which I already explained. So if you see continent-wise, there are 2 important aspects. One, that it could continue with some of the symptoms of COVID, or it may bring something new, and it has to be more than 12 weeks or 3 months, then it's a post-COVID, and from 4 to 12, it could be considered as a long haul effect of COVID. So this is a long COVID. Now, why and how it happens? So before that, where it could happen? Now, this image, what I'm showing you, is also in 2021. It may increase because we know some of the things have changed. So if you see, almost there is nothing in the body which is not affected by post-COVID scenario, long-term effect of COVID-19. The biggest one is fatigue, of course, 58%. But the second is like headache, or a kind of smell disorder, or taste disorder. So neurological issues, hair loss, if you see, weight loss, pain, joint pain, calf aches, this is common. But what is more interesting is something which is affecting your sensory function, because we know respiratory symptoms we know there are post-stress traumatic symptoms, we know there is heart issue, now it's common. But arising of some new thing like joint pain or seropositive rheumatism is now increasing. Diarrhea, persistent diarrhea, or in a way changing in absorption metabolism is persistent. In central and eastern part of Europe, you find a lot of female. It was before that it altering the menstrual cycle, but now it's more like a recurrent urine infection and cystitis. So menstrual alteration, urinary calculi, etc. was there before, but now it's a bit more and more. So you can see almost every system of the body, almost every part of the body is prone to get affected by post-COVID scenario. So this is just to give an idea, from hair loss till urinary infection, from diarrhea till headache, from fatigue till anxiety, and from male impotency till cardiac rhythm change. So everything is there. So this is the scenario. So now you will understand that it is a big thing. It's not small thing. I have more than 336 young children post-COVID hair loss. They are youngsters and they got depressed and they are really anxious and on some of the antipsychotic medicine just because they have loss. And they went to every doctor, they checked everything is normal, but hair loss is not stopping. So many things are there. So now, which are the major system affected? I told you all over the body, but what is considered more dominantly, that we will see now. I'm going a little bit quick because I have to finish this. So long COVID, as we know, respiratory and heart symptoms, so difficulty in breathing, shortness in breathing, etc. But fast beating or pounding of the heart or palpitation is a very common thing. If they go to the shower, their heartbeat goes to 110, 120. If they are a little bit stressed, their heartbeat goes stronger. If they walk a little bit, their heartbeat goes more than 110, 120. And they feel like it's pounding inside. So that's really bothering them, though it will not kill them, but that's really bothering them. Then joint or muscle pain is bothering. People work 2, 3, 4 p.m. They start getting pain, calf muscle. Many people are not able to sleep just because of muscle pain. Leg pain or muscle pain, they are not able to sleep. So then joint pain, as I already explained you, erectile dysfunction, I explain you all these things. So other symptoms. Then neurological, difficulty in thinking or concentrating like brain fog, which was already known, headache, sleep problems, dizzy when you stand up. This is very common, and especially the women and young children vaccinated, not young, means 20s, in 20 children vaccinated, they are showing this symptom a lot. That is post-COVID and vaccination both. Dizziness when stand up or lightheadedness. Pins and needles feeling, change in smell taste, we know already, and depression, anxiety, or felt like disconnected. That is the neurological or neuropsychiatric symptoms. Digestive, as I told you, diarrhea, stomachache. For now, in last 30 days, in many states of India, we have a new kind of viral infection, you can say. That is that children or adults, they are getting pain in the abdomen area, and then they have diarrhea. Loose feces, 6, 8, 10, 12 times a day, and not controlled by routine antibiotics. So this is something different. And now they are thinking that it's something like a variant of Omicron. They are thinking. So this is, in a way, all the system affecting. And then tiredness, fatigue, which interfere your lifestyle, or getting worse after physical or mental effort. And low-grade fever or evening rising fever. That is also a thing. So this is like the main thing, and subsidiary I already told you, from hair loss to everything. Now, more than that, there are certain things which are unexplained. Like people are feeling symptoms like ME, means chronic fatigue syndrome, or myalgic encephalitis, or even like MS, for example, but all the tests are normal. So it's very hard to explain and manage. And also they feel some symptoms which are in a way chronic illness after other infection. So it's really difficult to understand what is happening. Some people have health condition which they never before had, like diabetes, heart disease, or neurological condition, and most important, multi-organ failure. There are issues with heart, there are issues with lung, there is issue with kidney, there is issue with skin, bladder, brain, and also triggering autoimmune. For example, which you will see in the next diagram, and which I can show you at least 100 pictures, that it's reactivating herpes virus. So suddenly people are getting herpes rash. We have treated them like herpes. 3 months after, the same guy come with a bigger rash. It's reactivating. It's reactivating SLE, which is in the same category. It's reactivating herpes. It's reactivating rheumatism. So this is something which is difficult to explain why, but it's happening and it's creating new health conditions. And one more thing, those who were in intensive care, those who were exposed to medication, stronger medication, they have muscle weakness, not just muscle weakness. Now we have many young people with AVN, avascular necrosis in the humerus. Young children, youngsters, sportsmen who had, okay, I don't want to say any medicine, but there is a linking that they have this particular medicine. Many people having AVN had this medicine particular. And now it's proven almost, and now it is recorded also. So, and they are not able to walk. They have to replace the head of the humerus, prosthesis. Yeah, at the age of 18, 20, 22. So ICU, medication, it was before like post-traumatic stress, but now it's affecting to other systems. We have a big political leader who has to replace hip just because of this, the medication post-COVID or COVID, you can say. So these are some other things besides the main system, which we need to really understand. So why I'm explaining you this, because sometimes you may not be able to understand that I had this thing, but you may not link to your COVID infection, or probably if you have some medication, your medication, but it may be, this is a possibility. I have people also with bone cancer. I have people in Germany and in other countries with breast cancer triggered. I have people with pancreatitis. So I can give you plenty of examples which I have seen. Even 2 weeks before I was in some of the European countries, I have faced these people. So now, what actually, how it goes? So this is one proposed mechanism in one of the research study they proposed. So what probably is happening? First thing is COVID and long COVID. COVID and recovery is a straight line, but long COVID. So the viral antigen, when it persists, it provokes the inflammatory reaction. That is the main important thing. If the antigen is there, the antibodies need to act, and antibodies has to act through inflammatory condition. This is one thing. So what, again, systemic, before we were thinking of systemic inflammation, but now there is a tissue specific inflammation. I have a person came and he suddenly lost his right eye vision. And what they found is the artery supplying to right eye is blocked after COVID. So even it could go to a particular things. Then this herpes virus, I already told you, reactivation. So when herpes virus is reactivating, it can trigger to other similar kind of things. Dysbiosis, and this is really now we are seeing in these 20 days. You can see the gut flora reaction, and the people are seeing the feces strange. Huh? Some particles, it's before it used to be like mucus or something. Now it's a bit strange. They even don't realize that what they can see the particle eaten, half converted and coming out. So it's like really the synthesis, the absorption, the gut bacteria are disturbed in a way. So that is a problem thing. Microvascular dysfunction we know, and we strongly believe that COVID has triggered not just inflammation, but it has really altered the vascularity. And that vascularity is disturbed because blood is flowing all over the body. So vascularity can be disturbed in any part of the body. And of course, the SARS-CoV specific response, so these antibodies, they become autoreactive. So autoreactive immune, this will bother people because if similar kind of even influenza, similar kind of infection you will have much more stronger reaction than you used to have before. So your defense mechanism will be hyperactivated. So for example, if something goes in your nose, and before, for example, if you used to sneeze 3 times, now you will sneeze 30 times or 15 times for the same thing. This could happen. So these are the probable things. Besides that, because and this is most important, that virus toxicity, yes, we know tissue toxicity is there, the protein and all they use. But what is more important is the ongoing inflammation can dysregulate the immune system. And that's what happened in many of the COVID scenarios. So somewhere the immune system underacted, somewhere hyperactive. So what was needed really as an approach, immunomodulation, regulation of immune system. And that is happening, and that's why we are seeing some stronger reaction now. Then vascular, I already told, so I don't need to go further. Then hypercoagulability. What we are seeing, for example, even on the analysis ground, we are seeing that people who are affected by COVID, their platelets are going up or their D-dimers going up. So it's not maybe abnormal, but it's in the higher range, which if we compare his previous report, it was not that range. So the fibrinogen formation and all these things has been clear. That's why I told you, it's really changing the vascularity. And that could lead to many things. So then there will be thrombolysis and different things. And this is also known that the angiotensin, the renin-angiotensin system, so ACE, in ACE, what we call ACE1 or 2, that already affected by many, COVID. So this ACE, ACE2 or angiotensin, they are related to kidney function in a way, but they are related to the mineral metabolism. So then you can easily identify that people who were not having any issues, but suddenly they were having hypertension, or people who were not having any issues related to kidney filtration, now they are having the issues. So this is something which is triggering out. And as the virus present longer time, naturally your system has to work more, so that could get some inflammatory reaction. Reinfection also, damages to different organs. So there are many things which can happen. Now, something which we have changed due to lockdown or due to COVID or due to isolation, that is physical deconditioning. We used to do exercise, now we stopped because of lockdown and then COVID. We changed our exercise pattern. Now you see, we are online now. We have changed our presential work patterns. So this physical deconditioning would also impact. And medication, I already told you. Then the microclots, I don't need to explain more because it's a known factor that it was not able to transmit. The oxygen exchange was not happening because of that. So there are multiple these factors, and these the projection probable which we are seeing now. It's not really proposed. It's we are seeing in our day-to-day life that is happening in the bodies. Last 2 slides for the long COVID, and then we go to Ayurveda. So what it could bring to you, just quick. If it goes to central nervous system, it will activate the microglia, and these glial cells are part of neurons. So neuron damage, neuronal dysfunctioning, neurocognitive and psychiatric disorders. Now, if it interferes the coagulation activation, then thrombosis, etc., vasculopathy. If it increases oxidative stress, you're going to be old aging related issues on other things. If it activates autoimmunity, then there is a lot of autoimmune disorder and metabolic disorders. If it goes to peripheral nervous system, the inflammation, the base cause is inflammation, I told you, then it will create pain. Along with that, the psychological factor, environmental factor, that can increase pain or comorbidity, or that can also increase the neuropsychiatric condition. So it will lead to, if you go further, it will lead to different things. Along with that, if the cardiovascular system get the inflammation, then endothelial cell dysfunction or the myocardium, the connective tissue disorder, so you will have different cardiac myocardium pumping related issues. If it goes to lungs, there will be fibrotic situation, we know, that will create patch, that will create the lung or pulmonary vascular situation damaged. So naturally you will have acute coronary syndromes, you may have arrhythmia, palpitation, heart disease, etc., stroke, you may have breathlessness, post-exertional malaise, chest pain, exercise intolerance, dyspnea, cough, dry cough, persistent cough. And then, so if it continues, then you have multiple diseases, cardiac diseases, digestive system diseases, urinary system diseases, including kidney failure, cardiac system disease, including heart failure, reproductive system, male erectile dysfunction of female menstrual irrigation, it may affect also some progeny. Then it may have brain issues, psychology, it may have a whole body situation, it may have digestive system dysfunctioning. Also, it could affect the sensory organs because, and the temperature mechanism, because of the hypothalamus and the reward system. So certain desires like food seeking, food choices, motivation, consumption, that will change. So this is how is the impact of COVID to bring you, and its medication and its handling bring to long COVID. Okay. Now let's go to Ayurveda. As this I have already explained in the last AP lecture, that Ayurveda consider immunity under the term Vedic Shamatva. So they have 4 different aspects. They are not just against the virus or against the invaders, but they act against the strength of the disease. They act against the pathogenesis, which will go further of the disease. And that's what we are suffering now. We are suffering the further pathogenesis. And Ayurvedic system of immune management could prevent or could at least reduce the further travel of pathogenesis. So it will prevent the disease to occur, different disease. And the most important, that it enhances the body capacity to control. What we need now is a control or regulation. We don't need just boosting, we need a regulation. And that regulation you could achieve by Ayurvedic system. And there are different ways to achieve Sahaja Bala, because Bala is the one who could control. So strength you get by birth, or you could get, you use your strength you got by birth. There are certain things that certain families has a strength not to react with the respiratory issues. For example, me, whichever part of the country or other country I travel, if I get a mosquito bite or if I get a cold, etc., I never suffer with respiratory system, because all my family born in a strong mosquito area. So probably I have developed that. I have got bitten last 2 weeks before in Italy, big mosquitoes, red everything, nothing happened to me. In like a minute or 10 minutes is gone. So just these are the strength you have to recognize. Now you have to look at yourself back. You know, COVID has made that you have to review what probably wrong things you have done. So your immunity was not really able to respond. So what you need to improve. Then you get a strength by some acquired reasons like courage, using seasons, using age, using exercise methods or diet, etc. Okay. So now, what would be our in a way action plan? As I don't speak about this triangle because we have seen already. What is the second thing? If you see in the first pyramid, multi-system inflammatory syndrome. That is the base in all these. As I told you, inflammation and vascularity, so it can spread to multi-system. So what we could go with, we have to reduce the inflammatory scenario. So we have to reduce your body tendency to produce inflammation in the conventional medicine way. We have to reduce vascularity, and so in a way we have to promote normal formation of blood. So in our language, to work on Raktavasrotas and Rasavasrotas, Rasa and Raktavasrotas. Modulating the immune response, which already I told you, we definitely need to change lifestyle now. Definitely. And we need a kind of counseling and rehabilitation of our organ affected. So this is what we have to look at if we want to recover from long COVID process. This is what you have to advise if your relatives or your clients are suffering from that. So what could be the ways? Of course, herbs, because Ayurveda, but more than herbs, what is useful is the lifestyle changes of diet, spices, external cares. They are much more useful, and Panchakarma is absolutely useful, but I know there are limitations to practice in your country. So absolutely this is helpful, and plus yoga. Now, I'm just warning you that yogic practices you used to advise pre-COVID or you used to do pre-COVID, you have to be careful. We have many incidences where people had a less COPD, less space in lungs, youngsters, and they tried to overdo certain lungs exercise of yoga, and they become serious. You have to understand that don't estimate your capacity, which is pre-COVID as it is. So while advising, be sure. There are not many incidences, but there are few incidences. Today morning also in BHU, one young girl died while doing yoga practices within few minutes. Today we have seen in television, newspaper is also there. So what it means? It means that it's not that yoga is bad. Don't take it in wrong way. It's because you are not estimating or not measuring or not mapping again the capacities you have left post-COVID. So if you don't have that capacity, you have to enhance the capacity and then do the same yoga, same Panchakarma, same thing. If you are not mapping this and you are advising like that, that might make some harmful effect. Okay, so that is the scenario. So let's go first to the neurological situation. So neurological and neuropsychological system. What could be the way? So as Ayurveda, in the arrow, it's shown. Ayurveda says, if you have a psychological impact, maybe due to neurology or whatever, dhidharya atmadi vijnanam. So creating courage, intelligence, and self-realization. Courage to accept situation and modify your way of living. If you have post-COVID impact, let's say you cannot breathe much or you are coughing when you are talking, you should stop talking, reduce talking, reduce activities first and accept it. If you have pain, muscular pain, etc., after you stand for longer time, sit and work. Accept it. You need a courage to accept. Once you accept, then you can improve. If you don't accept, you question why. And then you don't follow the solution, you don't improve. So accept, understand, intelligence, and then self-realization. So for that, there are a certain treatment which in the circle I have described, which will be useful, which I will tell you. Then of course, external cares, as I told you, Abhyanga, Nasya, Shirodhara, and Panchakarma as a last resort, what you're allowed to practice. External cares really remarkably changes the neurological scenario and helps in faster recovery. It gives immediately sense of well-being. Within few days, you start feeling better. That's the situation. You have to understand. For example, if we think that this COVID has used the spike protein, etc., so naturally our muscular system is weak and requires something support. But that support we are not able to provide because our intestine, colon are also muscular in a way, in understands in simple language. So muscles in the body, they are not just affecting legs, probably they are inflamed in also colon. So you will not able to absorb what you need to. So then external support going through epithelial, endothelial way would be a useful way, because we know tvacha is a byproduct of Mansava Srotas. Tvacha is upadhatu of Mamsa. So it's a way to reach to muscle. Okay. So that's why external cares are useful. Then you need certain rules. Rules means you have to make yourself a bit disciplined. The indiscipline you discipline even in indiscipline, but the discipline or rule breaking which you could afford pre-COVID, you will not afford post-COVID. So you have to be having like a kind of square lifestyle for few months. You need to, for example, or you need to have a kind of particular schedule of working for few months. Okay, so rules. Then you need a motivation, and motivation is important because see, for example, if people are having this post-traumatic stress like intensive care unit, etc., so they are stressed and they are afraid, for example, to work or to lift something. So you need a motivation. Motivation can be given, which I told you, past good memories, which is below, that you used to do this. Now I'm not giving you this much, but I'm giving you this much. Okay, this is one way. Second way is distracting, means not giving him weight to lift, but giving him a bag which is of same weight, in a way. Okay, so it's kind of motivation. So you have to do this, but even in this memory and cognitive dysfunctioning, this is the time where you can use puzzles. Not strong puzzles, but puzzles. You know puzzle, the game, puzzles. People try. This is the time for them. It's like a child, you know. The child make this puzzle, solve this puzzle. It's like that. You have to give them this, and I'm sure. I tell you an example, and this is not related to puzzle, but this is related to even the active infection. When I was doing this first lockdown, the people who were admitted, they were really strong, good, everything was good, but they were not recovering, they were going down. Their oxygen percentage were going down, they were going down. So I didn't realize. Then I thought, okay, these are young people. They used to work, they used to talk, they used to discuss with it. And what happened in COVID? It was isolation. So isolation, as if like all their relatives, friends, and everybody stopped calling them, thinking maybe that the COVID will come from mobile. I don't know. So I realized that. So what I did, I took their friends' numbers. I called the friends or relatives, and I told them to call them once in a day at least. The moment they started to receive 3-4 phone calls, within 12 hours, they started to improve. Within 12 hours, and this is recorded in that hospital. We have recorded that. So really, this is important, okay, even puzzles. So now, how to increase all this? So Abhyanga or nasal drops. Simple things, you don't need complicated. If you have simple ghee, if you have coconut oil, well, if you have medicated ghee like Brahmi or Ashwagandha ghee and Yashti Madhugrutam. This is really important in neurological scenario. Why? I will explain you. Brain itself is a multi-dhatu organ in Ayurveda, even in conventional. It's a complex organ, it's not one. For example, brain is made up of glial cells and neuron. Neuron are made up of 3 things, where there is a myelin sheath, which is, you know, brain is 60% of fat and 40% of protein, water, etc. Blood, etc. So it is a complex structure of Meda, Mausa, Rakta, Rasa. It's not one. And Yashti Madhu works in this situation fantastic when you want a neuro regeneration. Ghee work fantastic because it directly attached with the myelin. So you don't need really to rush for something special. If you have, you do it, no problem. But if you not, just use simple things. So nasal drops, you can use ghee, coconut oil, Brahmi ghee or Ashwagandha ghee or Yashti Madhu ghee. Now, if you have anosmia, post-COVID, if you have still not got your smell back properly or your taste back properly, which is the case in many people, you should go with strong inhalation, strong smell inhalation. Like camphor, eucalyptus, strong smells, valerian, and practically you have to inhale, let the person sneeze. I have recovered the smell in 1.5 days to 5 days in active COVID just with camphor inhalation. Like that. I was giving the people, the relatives, the camphor finger, and then they were just holding to the patient. Even in the mask, I was putting camphor that time. It's different. So we use this, and people, now it's a chronic, so it takes big time. Even black pepper or ginger drops could help, but it's very strong. So if you could bear, it helps. So this is nasal. Then Abhyanga. What is interesting? In Abhyanga, you should use, which I have described in later slide, what oils you should use. But this Abhyanga is to penetrate more oil. This Abhyanga is to nourish the musculature, nourish the epithelial and endothelial, and reach through that to the muscle and bone. So it's not just, Abhyanga of gentle thing. You really need to rub, friction, and penetrate. Then you can use steam or shower or tub bath. Potali is one of the good thing with cereals, food grains, milk or meat soup, etc. That is a good thing, good insertion. And of course, Shurabhyanga Churudar, I don't need to tell about. Rasayana is one of the good things because Rasayana could, if they claim that it can make you new, like a snake leaves its skin and get a new skin, we can say it's exaggerated, but still it could really trigger the rejuvenation, rehab, and regeneration. So in Rasayana, for neurological scenario, Brahma Rasayana is one of the best thing. Okay, if you don't get Chavanprash is also there. If not, you can prepare your own Rasayanas, where you can, for example, Gotukola, Yashti Madhu, Guruchi, and Brahmi. They are 4 Medhya Rasayana described by Charaka, boiled with milk and taken empty stomach in the morning. Now, if you don't tolerate milk, okay, fine. You can use similar to milk thing. Okay, milk, sweet, cold, etc. You just justify, you use similar drink. This is Brahma Rasayana described by Charaka. And single thing, not many. So Gotukola and licorice seems to be common in UK, no? It's not very difficult. So as Shatavari, it's not really difficult. Okay, so these are Rasayana itself described by Charaka. So you can use that Rasayana, don't need to find Brahma Rasayana. If you find, you will take it. And moreover, Ashwagandha, we already know that it is supporting the neurological, neuropsychiatric, and insomnia, etc. So you can use Ashwagandha and valerian. Now, I already explained you the brain games, that is important, counseling and courage. So all this is the way you approach to neurological or neuropsychological condition. Okay. Now, how and what could we use? I will give you some examples, not all. So, to trigger, because if you have anosmia, you have loss of smell as well as loss of taste or change taste. So what helps is a kind of mouthwash every day. So gargling and mouthwash should you have to make like a routine practice, at least in season changes and certain season for next couple of years. Even if you are not suffering. If you are suffering, it has to be. So hot water, salt, or hot water and soda bicarb, or hot water and clove oil drops. These are the things you can use for mouthwash that protects you and that also stimulate the test buds. And similar you can do in the throat if you have some sore throat or respiratory issues. Because you have to understand that also comes from the brain is also playing part in that, in the sore throat. Then nausea, I already told you some of the things, but one more thing which you can use. Now, there are two examples I given you. Brahmi ghee, when you have cognitive issues, and ashwagandha ghee, when you have degenerative issues. So if you want to rebuild the neurons, if you want to rebuild some of the brain structure damaged, you use ashwagandha ghee. If you want to improve the impaired cognitive and dysfunctions, you use Brahmi ghee. Now, Yashtimadu, as I told you, is full in both. So that's why I already told you that. Now, if you cannot, and if you want to trigger or stimulate the neurological system, then there is a Vacha oil, what we use here. I don't know if because in some countries in Europe, this Vacha Acronoscanum is restricted. But if you get in your country, it's one of the fantastic things to improve. Or if you don't get Vacha, again, you can use valerian oil. You can prepare your own oil. No need to buy something, okay? As I already told you, nasal inhalation, but one more thing, which is celery. So if you don't have Vacha, if you don't want to use camphor, you can use celery. Okay, that is also, or even mint sometimes you can use for inhalation, which is a strong smell if you have this. This helps also if you feel like congestion post-COVID. Okay, and it helps to focus a little bit because, for example, Vacha, the first description is Sadhya Prajna Kavi, immediate intelligence creating. So, and I have seen that it helps in that way. So that is good thing. Then also because you have to reach to the brain whichever way you find. We know nose is one of the best way. We know that digestive system might be affected in that patient. So this way is not that fast. So you use eye way. You use eye conditioner, certain eye conditioner to stimulate. I have done that. Or you use nectar basti if you want to rejuvenate, and because anyway, nose, eyes, ear, throat are connected inside and they all are connected to the brain. So if eye is carrying the sense of vision, why not it will carry the nutrition as well to the brain? It will. Use that way because you cannot go so quick with mouth way. Okay. So, and of course, this kind of treatment sometimes you can see there. I have shown you a face with rice and milk application because this person, these persons, when they this cognitive interference, they feel something like burning here. They just feel, you don't see anything, and with such kind of thing, I told them to apply in the home. They're so happy. They are doing every day. So it is kind of distraction as well as skin nourishing and cooling. So they were happy. So similarly, you can use eyes. Then smoke also can be done. Means smoke inhalation of celery or ajwain. Tongue, rubbing on tongue, black pepper with little bit of ghee or neem could bring back your normal taste. Anything bitter, because it is said, Tiktam Swayam Arochishnu. So in a shorter or longer period, bitter taste will bring back your taste which you have lost because of fever, etc. So inflammatory condition. And bitter is one of the tests which is in a way anti-inflammatory in conventional language. One of the tests. Bitter, pungent, and salt they are different. They are working in anti-inflammatory scenario in a different way. Okay. So bitter or pungent could help you rubbing. As I told you, external application is fantastic. Mahanarayana oil or Vata Pacifen, because brain and nervous system is controlled dominantly by Vata with the help of Sadak Pitta and these four muscles, the four dhatus. So you have to use dominantly Vata Pacifen oil. Mahanarayana oil is choice, or Balaga Ashwagandha oil, or Dhanvantar oil, or Mahamash oil. These are the oils available around you probably, which I know. If not, you just use almond oil, coconut oil, or you can prepare your own Mahamasha. Mahamasha oil is black gram. Okay, there are some herbs, but black gram, and then Shatavari Ashwagandha, whatever you get, nourishing herbs, and you will make your own oil. And Mahamasha oil is a special oil which is even prepared with meat processing. That will be fantastic in neurological and neuromuscular scenario. Okay, so you can use Mahamasha oil. Animal fat. You can use animal fat, those who are not vegetarian, for this muscle pain, joint pain, and neurological degenerative issues or neuromuscular issues, pins and needles and pains and weakness and losing your balance. You can use. This is surprising, but this gives you fantastic results. I'm telling you, because as I told you, you need to nourish them, and the best use of skin you have to do. So the food preparation which you had given by mouth and digest and absorb, some of them you can use externally, and skin absorbs and skin utilizes. So this is one of the things you can use. Those who are vegetarian, of course, they will not use, but those who don't mind, they can use that. Then potali and tub bath could be useful. Internally, again, Yashti Madhu, which I told you already with milk, etc. Brahmi, Shatavari, Ashwagandha. But processed ghee, or processed coconut oil, or processed almond oil, or processed meat soups, that will bring you faster result. Because what you are doing some job of intestine and colon outside. So you are giving something which is more refined to that. That will fasten the process. So either you take a boiled milk, as I told you, it's Rasayana. If you cannot, because you have some issues with the milk, then you have these options. Or you can use coconut milk even, almond milk even. That is a little bit heavy to digest, so you have to use some spice, but you can use that. Then Panchakarma Basti is one of the choice in neurological or neuropsychiatric disorder. I don't know, in some places you may allow, because it's like oil basti. It's like small basti. If you could. In Charaka, there are Yapana basti described in certain such condition if you want to rejuvenate, etc. Which is a combination of boiled milk, herb boiled milk or just milk, oil, ghee, honey, and meat soups or bone marrow soups in many of the bastis. If you don't want, you just cut it. You can use oil, ghee, milk, and asparagus decoction or juice as a replacement to meat soup. You can use that. So this is one choice. And second choice, of course, Vamana, but I know it's not allowed. But however, if you could do a bypass of yogic process, but preparation like Ayurveda, it could be good. Okay. Virechana, again, same. If you do like a laxative way, it could be useful. And breathing exercise is one of the good things, like pranayama, but gentle, as I told you, I warned you, and some other yogic practices you could do. So I've shown some of the pictures, what we used to do this, and we have used that, and it is helpful in neurological condition. Now, there are two more things. One is pain management, because this is not just neurological, this is also affected to other systems. So we have to understand what is pain. Pain is a special sensation which you get because of the invader or because of the body damage or the probable pathology happening, either trauma or inbuilt. So it is a kind of hyperactivity or hypersensitivity produced. So Ayurveda says in the same, hyperactivity, hypersensitivity of brain, because pain is defined as a with Vedana, with knowledge, extra sensation, or Shula. So Ayurveda also thinks in that way, that it's the painful stimuli. And if you want painful stimuli, always create hyperactivity or hypersensitivity. And if you want to bring them rhythmic, the best way is fat. Ghee, oil, meat, animal fat or bone marrow. Best way is fat. Because then they don't let brain or peripheral nervous system run like you cannot run on oily track. It's as simple as that. Okay. So you use oil. You can use oil on the head if you have this, because I told you 45% people get headache. The second important post-COVID thing. So unexplained headache. So Shirodhara you can use Nasya. If you want to neurogenesis, you can do this Shirobasti. So different things you can use. And herbs in pain management is Google, commonly used, but this is underlined for you guys. If I go to Charaka and if I see Vedana Sthapak Gana in chapter 4, there are 10 Sutrasana chapter 4, there are 10 herbs described. Out of that, 7 or even 8 are spices. So one of the best pain management is external application of spices as well as internal. And that could help you. For example, if you have this arthritic-like pain, rheumatism-like scenario, because of COVID or medication or whatever, you can use dry ginger, pepper, and some mud or clay or kaolin application externally. That reduces the inflammation, that reduces the edema and pain as a management. It's not a cure, it's a management. And then same thing, you can make a decoction in drink internally. This I initially used in autistic spectrum disease children with colic pain, and they are not allowing me to touch for Abhyanga, etc. So I made a Hingvastak syrup and Hingvastak tea and I gave them, and they like it very much, and the pain reduced. So this is the way Ayurveda gives you tool. You just need to think and use. So you can use pepper, various kind. You can use ginger, dry, various kind. You can use some other spices like clove, for example, like cinnamon, for example. There is also other spices described. Probably you will not get this, but at least these two are dominant and you can get it, or 4 of this. So you can use that in a pain management. Okay. Then there is a general rule. This applies to all the system, but more neurological or neuropsychological or neurological and pain. But this is a general rule in COVID. And I wonder sometimes why people are so much after particular food, which really disturbs their system. Okay. So you have to avoid sweet, sour, salty, sticky. It doesn't mean sweet completely. Yeah? Sticky, sweet. Okay. Sour, sticky, or sticky, sour, sticky, salty. Liquid sweet, you will do, no problem. Okay. Liquid sour, fantastic. You can take, no problem. This like banana, for example, fruit, custard apple, for example, or raw tomato. You can have tomato soup, but not raw tomato, for example. Or in India, the Indian sweets or any chocolate, for example. You can have chocolate in the milk or in a coffee, like a liquid form, but not like a chocolate, for example. Okay. Then fried stuff. Oily seed. Because in COVID, people started to eat so much dry nuts and seeds, and they forgot that in a way they were feeding the COVID. If you see the mechanism of that, you will understand. I don't need to explain. I don't have time to explain that. But so please don't use too much oily seed or nuts. And if you want to use, associate them with spice. One of the easiest spice is black pepper, which is plenty around you and you use. Like on cheese and etc. You use on the For example, this sesame, this nougat, etc. sweets, if you see, there are some spices inside sometimes. So you use spices if you at all you are fascinated by oily seed or dry nuts. Okay. Then saturated fat, like you don't take curd or yogurt, but you take buttermilk, for example. Or if you want to take yogurt, make sure you will mix honey and little bit of amla in that. That is important for yogurt, any yogurt, steamed or integral or whatever. Okay. Then don't combine too many food. Heavy raw meat and eggs. This is really, I find, a strong trigger in India because people started to eat eggs after COVID to build, and this diarrhea thing really killed them. Absolutely disturbing the colonic function. Flatulence disturbing the colonic function. However, in winter, because now you will be approaching to winter, so it will be okay with eggs. If you cook it well or if you use spices, then eggs will be okay. But boiled egg or half-fried egg, absolutely no in COVID scenario, post-COVID scenario. Okay. Use bitter, pungent, astringent tests, which are really humidity reducing. All these three tests, they reduce kleda, they reduce meda, they dry up vasa, so they reduce really mucosity. This is required in especially chest scenario as well, not just the neurological scenario. And then as spices, I already told you. One of the interesting spices is garlic. Garlic is a neurostimulant. So I forgot, you can even use garlic smell and nausea. Garlic drops you can use, or garlic in the mouth for the test. I forgot to tell you that. So garlic, you can use even garlic oil for massage with almond and garlic oil, for example, or coconut and garlic oil for massage, or almond and camphor for massage, or almond and coconut for massage if you don't have medicated oil. So garlic is one of the good spice, and clove and cumin and celery, I've already told you. And then vegetables, like these are really good vegetables: drumstick, broccoli, gourds, bitter gourd, spinach, and cereals like barley. Because see, it's not about gluten resistance, it's about gluten create more stickiness in colonic scenario. So that's the problem. Okay, so that's why barley, millet, oat has little gluten, but you can still try. And some sour fruits. The best is like big lemon, which is one of the good thing. Of course, amla, we know, and pomegranate. They are good. Red oranges are good. If you miss your meat, if you are habitual to, then switch over to broths than practically eating meat in case of heavy meat. White meat or light meat you can eat. What is really recommended is some of the bird meats, which I will explain more in the lung scenario, but that could be useful in it also in here. Then well-cooked food, as per your situation, because I know many of you are working or many of your clients will be working. So advise them at least one good cooked food and one probably cooked and carry away food rather than just take away. So good cooked food could be useful. And the liquid diet is fantastic. The moment you feel like fatigue, tired, feverish, evening rise temperature, etc., just switch to soup, spicy, and you will enjoy. Then try to avoid humid weather, try to avoid closed rooms for now, air conditioners or congested surrounding, try to be better in moving air, etc. And non-exhaustive exercise or workout you have to avoid. Okay, then let's go to the lung scenario. Now in lungs, what happened? Because there are fibrosis or scar or patches, or they practically prevent from transition of oxygen from the alveoli to the bloodstream, so interstitial space. So you really need to work on the lung structure, and that's where Ayurveda is useful, because in many of the medical disciplines, this kind of regeneration of lung cells is impossible. But for Ayurveda, it's quite possible in younger generation, because Ayurveda explains how the lungs is developed in embryology in chapter 4 in Sushruta, and also in Charaka in Chikitsa in Grahani. they describe how certain organs are produced. So, Shonita Plena Prabhava Kukusa means blood, inside the blood, the vata goes and produces like a bubble. And this bubble form structure is lungs. So, in fact, from the rakta, the byproduct is kandara and sira, so vessels plus the outer layer of the lungs, and inside the alveoli are like bubbles. So if we could promote this scenario, we could rebuild. That's the idea. So that some of the recipes are down after, I will tell you. But with that, what you have to use if you want to recover, it's a clear indication. Yat kinchit kapavataganam ushnam vatanuloma. That's the line. Whatever is vata pacifying, kapha pacifying, hot, and vata redirecting, that you have to use if you want to rehabilitate. And you just need to link. You don't need to find lung damage, because we have conditions. In Rajakshma, we have described urakshata, means chest injuries or damaged lungs. In Kasa, we have two types, Shayaja Kasa and Shataja Kasa. We have this. It's not same, but similar, because anyway, as the period goes, the things evolves, different things comes in, but the structure is same. Maybe there is not influenza virus, maybe there is coronavirus, but what it is using is the lung. So if we damage the lung, the structure is same. So we have these recipes. So I have given you some of the recipes, but you can search and find interesting, simple recipes which would help the people a lot. Okay. So in that and second line, they says Akta Lavana Tailena. So always you should apply on the chest of the people salt and oil. Always in respiratory disease. So salt oil application is one of, because you have to understand, it's not about the space in the lungs, but also many of them, they have labored breathing, like, because this muscle strength is not there. So you have to, you're not doing just for lungs, you are also easing the laboredness. So you have to do that. So everyday salt oil application, and in case of breathing issues, you can use dry ginger in water outside. Even celery seed in a potali, and you can foment on the chest. Okay, so that's one of the things you can use. Then, as already told you, it is a bit of repetition like camphor and celery inhalation that helps you in breathing issues. Even in acute condition, camphor inhalation increase oxygen percent by 6 to 10 for like 20-30 minutes. I have done that in intensive care unit. I have done a lot of experiments, so I can tell you this will help in breathing issues. And it's very simple logic I use, because in India, when people go to pilgrimage in Himalayas, all the older people, they say there is less oxygen, so they carry camphor with them. And when they are climbing, they rub and I remember my grandfather asked me when he was going there. In COVID, when I saw that lack of oxygen, people are dying, first thing I remember is my grandfather carrying that. And then I searched in the text and I found and I used that. So that is repetition, but it's a useful thing. Then gargles followed by, this is for dry cough, one of the fantastic recipe. If you are really dry cough, you use licorice, salt, licorice tikka, not extract, or powder, salt, camphor or mint, or chitobladi churna. You can mix in that and chew that, practically chew, not like that. You take and put inside or chew practically. It will really help you to reduce sore throat and dry cough. But it has to be followed up, means first you have to have gargling, salt hot water. Even the last gargle you can swallow. And after that, 3, 4, 5 minutes after, you can chew, leak that or chew that. One of the fantastic recipe for dry cough. Okay. Then to rebuild lung, as I told you, it is the foam. So best is pippali boiled milk. Vardhaman pippali rasayana, because pippali milk is providing the blood part or rasa part, Rakta Rasa part. Pipali is providing the fire to make it Rakta, as well as increasing Vata. Alone Pipali increase Vata. Dry Pipali alone. So Vata part bubbling, and Pipali look like lung. If you see the picture below, it look like lung. And when you cook, it is inflamed and it will look like lung. So it's one of the best rehabilitation for lungs. I have plenty. Today morning, and the woman really was so happy. Post she had COVID, and then she had like one word she cannot speak. Like that. One word. Coughing like that 200 times created spondylosis, other problems, you know. And so it's been 3 months, and today she spoke 2 hours without coughing. And what I use, one of that is 4 times Pipali Rasana. I did Vamana, of course, once. 4 times Pipali Rasana. She's applying oil all the 3 months to the chest. And this licorice thing she's chewing. And one more recipe, which is you will see after. That's the only thing she's taking. She had a palpitation. Even just she walks, she was having 114. And what helped her is just external application. Now she's static. At the most, when she takes shower, 95. Otherwise, it's between 80 and 90. This happens. Today only she come. I told her that I will tell today evening your case. So, Pipali boiled milk. Again, a combination, if you want to, Yashtimadu, Shatavari, cinnamon, clove, tulsi, mint. Any 3 or 4 of these. It's your choice, your availability. What is required mandatory Yashtimadu, probably. Okay. If you don't have Yashtimadu, then Shatavari. But Yashtimadu is in a way necessary. Then you can use cinnamon, clove, tulsi, mint, anything. Many times in dry cough, Hingvashtak churna with ghee before meal helps a lot. Because for us, this dry cough is Vata, yes, okay. But if we see the pathogenesis, it's the obstructed Vata. Adho, downward obstructed Vata. And what I told you, yet kinchit kaf vataganam ushnam vatanulomanam. You do anulomana, Hingvashtak is one of the best. If you don't have Hingvashtak, you use Triphala, but sometimes Triphala is really tough. It dries you out. So probably Hingvashtak with ghee is the best solution you can use. You can prepare a fantastic ghee for rebuilding the lung tissues. And this is what the woman is received today. Is Yashtimadu, licorice, grapes or raisins. You boil, you make a decoction, you add ghee, you prepare a ghee, and as a kalka, as a support, pepper or long pepper. Again, the philosophy is same. Licorice, Yashtimadu, and Draksha, grapes, are Rasa Rakta producer, and pepper is producing the bubble, and the ghee is giving the construction or rebuilding. And this I have used at least 60 patients in last 3 months. So this is really helping. And then Rasana, you know already, Chavanprash, Kantakarya, Uleya, etc. Okay, so you can use the Rasana. Last two slides, I think, or 3 probably, and then I will stop. I'm still in time, probably, maybe 10 minutes. So now for lungs. Okay, what is yes? Red rice, brown or black rice also. Nowadays it's a fashion for black rice. Barley, moong, wheat, black gram, ulatha, that is horse gram or the Latin name I have written there. Radish or the small or young radish, the root radish, you know, like carrot radish. That is really good. Garlic, honey, salt, of course. Goat is fantastic. They describe in respiratory tract, goat milk, goat ghee, goat buttermilk, goat meat. If you have this, you are done with respiratory tract. This is the exaggeration, but what they have written in the classical text. In Bhaprakash, in Yogaratnakar also. So, goat milk, ghee, bird. If you are with a bird or moving animal or dry and land animal meat. And there are some vegetables described, but I translate it in English, and they say goose foot or lamb's quarter. I don't know if you get that. It's called vastuka in Sanskrit, but I don't know. You can check. So that vegetable is considered very good in lung scenario. Okay. Of course, spinach, drumstick, they are good, but this is a special. Then what is no is bitter gourd in lung scenario, Karela, no. Aubergine, no. Or if you want to use aubergine, you like it, then you have to fry it. This is a trick. Okay. You have to fry. And then you have to process like a vegetable, like salt, and if you use ginger, kurkuma, whatever, asafoetida in India. Okay? Mustard is not really useful. Sweets and saturated fat, etc., that you know, kapha is presenting. Now, in dry cough, there are some recipes which are specifically described and which are useful besides. The most useful I already told you, licorice, etc., but these are also useful. So, dry ginger, spiny or teasel gourd or balsam pear. These are the three English names for one gourd which has the thorn like Karela. Karela is long and that is small. Okay, so or Chinese cucumber. If you take that, fry in ghee, and you make a juice or you just eat, it reduces dry cough. Okay. Clove, pepper, bibitak if you get. If not, you just replace it by anything which is astringent and sour, or you can just replace it by amla if you have. Then acacia juice or acacia gum you can use. Acacia bark tree decoction also, and sugar. And you can make like a pill, you know, and you chew. Okay. What is important is clove. This is a smaller version of Lavangadivati, which is used in classical text. But this is also classical, not my mind. Just the modification are my mind. Okay, like make a pill or use gum as well. Then pepper and long pepper, 1 part each. Pomegranate, 2 part. Yavakshara, half part, and jaggery, 8 part. You can make a pill and you can chew. These are options. I tried to find recipes which you could do, because pepper you have, probably long pepper is very common. Also people you can get easily in UK. Pomegranate you can get, and this Yorkshire is barley salt. If you don't get Yorkshire, use any salt. Okay, and molasses jaggery is available. So these are the things which will help sore throat and dry cough besides gargling. Okay, and of course the first recipe H2O is fantastic. Then if there is a lung damage, some simple things like coriander, long pepper, dry ginger, and Dashimola decoction described in your Ratnakara. Second thing is cardamom, cinnamon, clove, and Nagakeshara if you get, Mesua ferrara. If you don't get, leave it. 1 part each. Dates, 2 part. Raisins, licorice, sugar, and long pepper, 4 part. You have to make a jam, like a Chyawanprash. Fantastic. It tastes nice. Little spicy, but tastes nice. And then at the end, like you can make a jam, like fruit jam you prepare, then you add the spices and honey, mix it. Honey is a self protector. Eat 1, 2, 3 times a day. This is a jam described in Vaishyaratna, for example. Okay. I use that. I use to many asthmatic patients, COPD. Then, as I told you, goat meat soup, long pepper, barley, horse gram, dry ginger, amla. This is the combination, and pomegranate. This is a combination of soup. Either you can make like a food. Sharanga Yusha, it's called. It's also in Yogaratnakara and in Bhav Prakasha. And in that, sometimes you can take 2 part of meat. 2 part of the all the things like the horse gram, etc. 8 part of meat and 2 part of meat, 8 part of water, and 1 part of the herbs. And you can reduce to 1/4 if you want like a medicine to prepare. Then they have used also, in fact, this is an interesting recipe. I have not suggested, but I had this in mind. This is goat meat and deer meat powder, like dry. You can make it dry, make like a powder and take it with goat milk. Also, they use lot of recipe with rabbit milk. Birds they use is partridge, gull, and peacock and the pigeon. These are the 4 bird meat they advise in lung regeneration. Now, if you want to use, you can use. If not, leave it. Now, breathing issues, simple thing like jaggery and mustard oil jam. It's not difficult. You just need to take oil, you need to take jaggery, you just heat it up, it becomes like a jam, you start leaking. It eases the breathing. Okay. Then fresh ginger juice and honey or pinch of black pepper in that. Eases the breathing. If you want to make bit more stronger, then turmeric, pepper, raisins or grapes, jaggery and long pepper. Use oil, mustard or normal oil and make a jam. Like a breakfast, you can take it. Then also cardamom, cinnamon, betel leaves, that green leaves in India they eat. I know in UK you find that. I have bought it and I have eaten it, so I know that. In UK you can find it. That's why I taken this recipe, otherwise I would not have taken. Pepper, long pepper, dry ginger. So 1 part cardamom, 2 part cinnamon, 3 part betel leaves, 4 part pepper, 5 part long pepper, and 6 part dry ginger. This you have to mix, so it's really a spicy thing. Huh? And then you use it with honey, ghee, or jaggery, whatever you want, as a leaking. This I have used to this lady. Okay. Then you can make a ghee of licorice, pippali, raisins or grapes, and Solanum nigrum or Solanum indicum, Panchakarma, if you get. This is also useful in breathing issues. Then the last slide, as I told you, 2 more. Heart damage, Ayurveda care. Because again, heart muscle damage leading to change in the rhythm of the heart, inflammatory condition, and emergency insufficiencies in the heart. Besides vascularity. So vascularity is another thing. You get a clot. So again, heart is developed by Rakta, Mamsa, Ayurveda says. So you have to do Rakta Mamsa and control on Vata, especially Prana and Vyanavata. So again, if you want to support Mamsa application and keeping oil on the chest location, which is left lateral from second rib to the breast point, sternum. So between sternum and breast, you can put a hot oil cotton. This was this woman doing. Her palpitation rate in 3 months is stabilized completely. Nothing else. Also, she asked me Arjuna. Sometimes Arjuna is also very good in this, but oil application. Or, and then once this is cold, you have to put it hot. When it's cold, you can do the massage. Okay? Or you can do Hrudbasti, which is shown. If you want to do it like a treatment in the picture, you can see Hrudbasti. Then dry ginger also is useful. Arjuna tablet or powder, Arjuna boiled milk is also useful. 2 more things which are described classically fantastic. One is Hingvastak Churna. Hingvastak Churna after meal is really good for cardiac scenarios. Shadharana Churna is classical situation. This is Chitrak, Indrayo, Pata, Kutki, Haritaki, and Ativisha. This is the thing. And then spices, asafoetida is good, garlic is good, cardioprotective. Pomegranate, mango, grapes, orange fruits, they are cardioprotective, so you can use in different recipes. And gentle but non-exhaustive exercise. I think it's almost done, my time, so I stop here. If you have a few questions, you ask me. Thank you for patience listening.
Thank you so much, Dr. Marda. We are over time, but if it's okay with you, we might just stay another few minutes to answer a couple of questions.
Yes, no problem.
Okay, so Colette, do you want to ask?
Right, yes, Dr. Marda, someone asked about which asanas should be avoided. I think this was a comment earlier on when you were talking about.
No, I have not said any asana should be avoided. I have said that estimate the strength of the person. For example, if there is a COPD, advising them strong pranayama like Kapalbhati exercise not really good. Or if they are already having palpitation, for example, cardiac, then this asana is not useful. Imagine if they have diarrhea, for example, you are advising them Pavana Muktasana or something. It's not really advisable at all, you know. So you have to think the situation and you advise asanas. But what my underline was, the asanas they used to do quite well previously, they might not be able to do in the same way now. So estimate their capacities and go slowly. For example, people before they used to do 10 Surya Namaskara, 15, and now in 3 Surya Namaskara they fall down. So then you have to tell them, no, 2 only, not 3. This is something rebuilding. Okay. One thing I forgot, even a salt, sugar, water is a very good remedy for stand-up dizziness. I forgot to tell you. Salt, sugar, and water, stand-up dizziness. Because I realized. Okay. So I'm not telling to avoid any asana. I'm telling estimate the person and go slow with the condition of the person. Okay.
Thank you, Dr. Marda. Cam Dillon asked about, instead of using puzzles, can they do creative work like coloring or painting?
Absolutely. I mean to say puzzle means something brain work which will be not strong, like children, I told you. Children try to join the things. Similarly, you can use color, anything which make their brain work with the help of sensory organ, but non-exhaustive. That's fantastic idea, this color thing. Creative work is a really good thing to do. That will bring the positive energy as well, because they have created something, you know.
Thank you, Dr. Marda. Then also from Cam Dillon, which rasayanas to mix with milk and have on an empty stomach?
Which rasayana?
Yes.
I told you already, this licorice boiled with milk is rasayana itself. Gotu kola boiled with milk is rasayana itself. Brahmi boiled with milk is rasayana itself. Shatavari boiled with milk is rasayana itself. So there are plenty. These are around you, so I told you this. Pippali boiled with rasayana is good. Boiled with milk is good rasayana for chest, for example. Okay.
Then a question from Sangi. She's asking, client had developed tinnitus post-COVID. She's thinking about providing Nasya Karnapurana Netrabasti. We'll be grateful for any good advice on herbs and other treatments.
Nasya is fantastic. Netrabasti will also help. Karnapurana will not help. Instead of Karnapurana, you do Abhyanga around the ear and face. This will help because tinnitus, Karnapurana and tympanic membrane, it will not really transmit. It is from there. So you have to go through the extraction tube either that way. So you do Abhyanga outside. Definitely Nasya 100%. And Netravasti will help well. If you want for your peace of mind and patient's peace of mind, you can put Karnapurana. But it will not help in tinnitus of post-COVID.
Okay, thank you. Iris Hutner asked, is there a reason that for Kavala or Gandusha, sesame oil was not mentioned?
Basically, this treatment was mentioned for neurological issue. So I have mentioned about the things which could stimulate. It was not like a Kavala for regular practice. Regular practice, you can use oil pulling sesame oil. This was for specific purpose of stimulating the taste buds or stimulating even the olfactory scenario, though it's in the nose, but it passed through and improve the throat scenario. So that's the reason we mentioned clove oil. Anyway, Ayurvedic clove oil is prepared with the base of sesame oil as well. So sesame oil is there anyway.
Thank you. Rachel asked, a friend with long COVID has started taking antihistamines. She said there has been a small-scale study about the effectiveness of antihistamines in managing long COVID symptoms. It suggests that long COVID can impact T cells' histamine production, so the body thinks it has pathogens or infections and is working to fight them. I would be grateful for your thoughts on this from an Ayurvedic perspective.
Yes, this is one of the things people are doing, but as I told you, basically what they are saying is managing symptoms. What I'm talking about is recovering the symptoms or recovering the whole scenario. So if you are suffering a lot, for example, you can take antihistamine in lower dose, but you have to understand you are triggering another mechanism. For example, one of my patients today morning only, he has this, he was having cough and it's not really cough, but mild cough and always rhinitis and post-COVID. And he suddenly, because it was not recurring, so he went to his doctor. Doctor advised him to do sugar, and suddenly blood sugar was high. So he called me, and I told him, "Okay, you come." But the doctor said also other test because he was on antihistamine, okay, because of this thing for about 6 months, and his IgE levels are super high now. So he is now more prone to get what I told you is a kind of reactivation of some of the viral infection or some of the invaders because it's a hyperactive. So it's a kind of thing you have to understand. Low dose antihistamine to manage the symptoms. If you are suffering long, go ahead, no problem. But if you want to recover, this is not the solution. Because after you will be dependent, first thing. Later, the antihistaminic you use will not work. So sooner or later, you have to go on higher dose. Okay. And third thing, that it can create some other scenario. Instead, if we go back, for example, to improve his skin condition, as I told you, external cares could help. Along with antihistamine as he's taking, he could do external care. Slowly is off antihistaminic and continue the external care. That would be the great scenario or good scenario for him.
Dr. Marda, we have last two questions. First one is about which oil would you recommend for tinnitus? Coming back to Sangi's earlier question, this is from Iris actually. Which oil for tinnitus patient
Oil
to
for
go
external
around?
use. For external use, as I told you, you can use any vata pacifying oil. If you don't have medicated oil, you can use almond oil or coconut oil. They are one of the good vata pacifying. Just you can add some clove or some camphor in that to improve the penetration more. If you have vata oil or mahanarayana or this, you can use that. That's not an issue. And for nostril drops, better ghee. And if you have possibility of Shatavari Ashwagandha ghee, that will be the best for tinnitus. Even by mouth, you can use Shatavari for tinnitus. Shatavari is one of the very good thing for tinnitus.
And finally, the last question. Have you noticed any difference in long COVID symptoms between vaccinated and non-vaccinated patients? That's from Vanessa.
Well, this is this question I would not reply fully because being a practitioner, we are seeing benefits as well as hazards of vaccine. So it's too early because it's said in if you go to CDC, NIH, if you go to NICE, etc., everybody says vaccination will be helpful to not to have long COVID or to reduce long COVID. But as I told you, in practice, you can find in some people that's happening. Because, for example, people, they got COVID vaccine, they have no long COVID as if at all, means they have no symptoms. So whether it is because of vaccine or whether it is because they got COVID, but they have their own system well, so they didn't got. So it's difficult. But definitely, we see the people who are had COVID, vaccinated, and almost no long COVID, little bit of no post-COVID thing that we have seen. But we have seen also people, COVID or not COVID, vaccinated, because you have to understand, vaccination is in a way producing situation like antigen in your body. So if there is antigen in your body, body will be, to produce antibodies, body has to go through this inflammation scenario. If inflammation scenario goes well, antibodies are produced well, probably you will not suffer. If it doesn't go, then it will be like the same, like post-COVID. Okay, so we have seen people, COVID, non-COVID, vaccinated, and some effects. So that's why I said I'm not going to reply this question, because I am experiencing both the situation, and as it's too early to conclude. Okay.
Thank you.
So thank you very much. Have a great evening. Oh, no, sorry. Yes, have a great evening. For me, it's night. So have a great evening and enjoy your dinner if you have not.
Thank you, Dr. Marda, on behalf of everybody from the APA and all the participants. Before we finish, if you could just join the answer 4 questions quickly on your screen to give us feedback. And we have 3 upcoming webinars in the next months, 2 in October and 1 in January with Dr. Claudia Welsh. And the next webinar is in 2 weeks with Vaidya Jaran, and it's going to be about Ayurveda for modern parenting. So I've shared the link in the chat, so we hope to see you there as well. And Colette, would you like to conclude?
Thank you. I also just wanted to thank Dr. Marda from all of us at the APA, and I'm sure all the members found it really valuable as well. So thank you for that.
Thank you, and hope to see you soon in future.
Thank you very much.
Thank you.
Thank you. Have a good evening.